All right. Hey guys. This is welcome to my living room in Massachusetts. This is my younger brother, AJ. He's going to be helping me out. So this video is for shoulder, the shoulder lab. The only thing we will not be going over in this video is special tests. You will need to fill out that portion on your lab, but I'm not going to be going over them. Therefore, they will not be on this practical. They might be on the final, but they will definitely not be on this practical. All right, so first part is palpations. So there's quite a few. We'll start with the anterior side. So the first part is the sternum. So the sternum's right here. It's typically called the breastbone, right in between the two pecs. Okay. So it goes all the way up and all the way down to just above the stomach. Okay, so the top part of that is the manubrium. So right here in between your two clavicles, which I'll show you in a second. So right in the center part, you've got your jugular notch. Okay, it's that divot right at the top. So at the top, right at the bottom of that is the manubrium. Then on either side, we've got the two clavicles. You can kind of see here and here. Okay, so they go just like this out to the side. So the SC joint, so sternoclavicular joint, is the sternum. So it attaches the manubrium and the two clavicles. So there's two of them, one on each side right here. So we go up the clavicle. Then on the outside, if we palpate all the way along the clavicle, on the outside we've got the AC joint. Okay, acromioclavicular joint. Just below that here, so you've got kind of the arch of the clavicle, and then just below that in this little divot is the coracoid process. And then, like I said, at the tip of the clavicle is the acromion process. So the very edge of the shoulder, and then just on the inside of the deltoid. Then, of course, we've got the humerus, which we've talked a little bit about. Humerus is this nice long bone here. And just on the front of that is the bicipital groove. That's where the biceps tendon runs through and over to the back. The greater tubercle is just below that acromion process. It's right on the outside of the deltoid, just about here. And then just below that is the lesser tubercle. If you have someone with bigger deltoids, you might not be able to feel those as distinctly, but they are there. Then we've got a few muscles. So the subscapularis is just goes in here, right in front. So right here is your trap, right, which we'll go over in a second when we talk about the back side. So it goes just down here underneath the clavicle, okay, to the scapula. Okay. So actually more like this, up and back. And we've got the pec major right here, big muscle, typically.
Tough.
We got the pec minor. Okay, so that one goes, that one's a lot smaller. It kind of goes right in here towards your armpit. The long head of the biceps tendon is what I was talking about, that goes up. So the biceps muscle is here, and then there's two heads. So the short head attaches to the humerus just about here, but then we've got the second long head, which goes up and over through that bicipital groove. And then the serratus anterior is through the neck and just to the clavicle. Okay, so it's a little bit more anterior in that front part. Okay, if you could turn around, please. All right, then we've got the posterior side. Okay, so we go along the tip. We've got the tip of the shoulder, so the acromion here, but then we go along and you feel a ridge just about here. That is the spine of the scapula. Spine of the scapula here. And then we've got, if you feel, so the scapula itself is a triangle shape. So it's like this, okay? So the inferior angle all the way down here, okay, is the bottom tip. And we've got the medial border of the scapula. So that's along here, right? Because it's more medial to the body. Here's the spine, medial border, and then the lateral border is over here. And we've got the supraspinatus right in here. So above that, we've got the spine of the scapula, and just above that spine, there's the supraspinous fossa, and in that is the supraspinatus muscle. And then below the spine, kind of on that big triangle right here, is the infraspinatus, right below the spine. Then we've got the teres minor, which goes in the back around here. That's part of the rotator cuff, okay? Along with, we've got the traps. So the traps go along the spine, and then they look something like this, or big triangle, okay? So there's 3 different parts to it. So there's lower traps, which starts right about here, T12, and goes up. And we've got the middle traps like this, and then the upper traps attached to the skull and down to the scapula. Okay, and then in between the scapula and the spine are the rhomboids. And then from the lateral border of the scapula down the side of the body are the lats. So those on the lateral side of the lats. All right. So that's it for palpations. All right, so hello. So now we're gonna go over some goniometry of the shoulder. Most of this we went over in that 2nd or 3rd lab, but I am gonna go over it. I'm gonna go over which parts of the goniometer go where. It does say in your lab, so if you wanna look at your lab while watching this video to understand, that's great too. All right, so first one is shoulder flexion. So typically, I would have my patient laying down flat. Unfortunately, this man is 6'4", and he does not fit on our couch, and this is the longest surface we have, unless I have him on the floor. So, I'm just gonna show you, yeah, that works. All right, so first is flexion. So stationary arm goes along the torso, okay? So stationary arm here goes along the torso, just like that. The fulcrum along the, in line with the acromion process, or the AC joint, okay? So that tip of the shoulder. And then the moving arm is gonna go along with the humerus. So I would have him flex his shoulder, so bring his arm all the way up towards his head, good. As far as you can go. Yeah, there you go. Okay, and just like that. All right. I tried to find a darker one, but unfortunately, this is the best I got. So then we've got extension. So for this one, I would have him slide just a little bit off this way. Normally, of course, I'd be on a table, so the couch itself is very close to the ground, so we won't really be able to see his full extension, but the alignments are going to be exactly the same as flexion. Okay, so acromion process, the hold that there for me, the stationary arm along the torso, and the movement arm along the humerus, and then I would have him extend his arm all the way back, so down to the floor. He can bend his elbow if he wants. There we go. Good. Okay, so keep that there and move along with him. Okay, then we've got abduction. So abduction and adduction, so these are vertical, the two vertical motions. We'll go over horizontal ab and abduction of the shoulder in a minute. But the two vertical ones, so this time I'm going to have my fulcrum on the front of the shoulder, anterior to the acromion, okay? My stationary arm is going to be, again, along with the torso, and my movement arm is going to be, again, along with the humerus. This one is tricky because we have to stay out of the way of the motion because it's going to bringing his arm out to the side, if you guys remember that. So then I have him bring his arm out to the side, all the way up as high as he can go, and just about there, okay? Just like that. And then for adduction, same thing, vertically. So same exact alignments, fulcrum on the front of the acromion, stationary arm along the torso, and movement arm along with the humerus. And then I would just have him squeeze his arm in tight to his body as best he can, not crossing the body. That's horizontal. Not there yet. Okay, so just into as tight to his body as possible. If he was not able to do that, if his arm just kind of stayed far away, we'd be wondering why that's happening, right? Okay. Then we've got internal and external rotation. If you guys remember this, so we would have the patient, you can slide back a little bit, because I want his upper arm resting on the table, and I'm going to bring his arm out like this, hands straight up, okay? The fulcrum is going to go on the tip of the acromion process, and then the stationary arm is going to go pointing up either at the ceiling or pointing down at the floor. For this, I'm going to show you pointing up at the ceiling, and then for internal rotation, I'm going to have him turn and bring his palm down to the floor. Good. Just like that. And then for external rotation, exact same alignments, but I'm going to have him turn and bring his palm to the ceiling. Good. Okay, just like that. Should be about 90 for both of those. If it's a little more, good for you. And then lastly, we have horizontal flexion, which is also called horizontal adduction, adduction. Okay, and then horizontal extension, which is also called horizontal abduction. If you have those on the practical, I will say both. Hopefully. Okay, so for this one, we're going to have the fulcrum again on the acromion, so it's going to be pointing up at the ceiling just like this. We have the stationary arm is going to be pointing up at the ceiling, and then the moving arm is going to be going along with the humerus. So in order to do this, I need him to bring his arm straight up into 90 degrees of flexion, and then I'm going to have him bring his arm across his body for adduction, adduction, okay? And just like that. And then for horizontal abduction, same exact alignment. I'm just going to have him bring his arm off to the side like that. Okay, this one you do tend to want your patient to be, their shoulder should be off the table, because that way the table's not limiting their range of motion. All right, and those are it for Goni. All right, so last section, we've got our manual muscle testing. So first we'll start with flexion. So you can have them either sitting or standing. In order to get both of us in the video, I keep cutting off my head. I'm just having him sitting. And then, so we want him to start with his arm down at his side. I'm going to stabilize his shoulder. So my stabilizing hand is going on his shoulder. And then I'm going to resist at the base of the bicep, so just above the elbow, okay? And then I'm going to have him flex his shoulder, bring him all the way up. So well, first we'll do grade 3. So I have him go up through the motion by himself. Good, all the way. Okay, then we've got grade 4, where I'm providing a little bit of resistance, go all the way up. Okay, and then grade 5, a little bit more resistance, and then I'm gonna have him hold it there, and then I'm gonna try to push him down, okay, for 5 seconds. All right, then we've got extension. So can you actually turn to that side? All right, so same thing, I want his arm all the way down to the side. Good. Okay, so stabilizing again the shoulder, and then this time I'm gonna be resisting behind his elbow, just like this. I'm gonna have him bring his arm all the way back towards me as far as he can go. Okay, so that would be grade 5 right now, because I'm providing maximal resistance, and then I would have him hold it there, and then I'm gonna resist and push down for 5 seconds. Okay, so that was extension. Then we've got, what is it? External and internal rotation. Well, let's do ab and adduction first, because external and internal rotation you're going to want to see from the side. So abduction, I'm going to stabilize the shoulder. I want his arm down at his side. So this is vertical abduction, okay? I'm going to be resisting, again, just above the elbow, but this time on the lateral aspect of the arm. And then I'm going to have him bring his arm up. I want his palm up, yep, and all the way up to the ceiling. Just like that, and hold for 5 seconds. I'm not actually making you do the full 5 seconds. Okay, and then for adduction, it's the same thing, but this time I'm going to switch my hands, because what I want to do is I want to stabilize the shoulder here, but I want to put my hand on the inside of his arm, and again, I'm going to have him squeeze his arm to his body and hold it there, and I resist for 5 seconds. Okay, so that was a vertical ab and adduction. And then of course we've got horizontal ab and adduction. So I'm going to have him bring his arm to 90 degrees of flexion. For abduction, again, stabilizing the shoulder, and then on the outside of the arm, and then I'm going to have him bring his arm out to the side, just like that. Notice how I'm standing behind him, because that gives me the best angle of resistance. Okay, relax. And then for horizontal adduction, I'm going to stand in front of him, and this time I'm going to, again, have him flex just about here, and I'm going to actually stabilize the opposite shoulder, okay, because I don't want, when he does it, I don't want him bringing his shoulder, I just want the arm motion itself. And again, notice how I just did that. I'm bringing my arm in, but we don't want to count that elbow flexion here, right? Because that can be excessive. So what I want to do is stabilize that opposite shoulder. Actually, can you turn to the front, please? Okay, so that opposite shoulder, and then on the inside of the elbow, and then I'm going to have him bring his arm across his chest. Just like that. Good. Okay, and last but not least, we've got internal and external rotation. I'm gonna have you turn to the side one more time, sorry. Okay, so same as how we just did goniometry, I'm gonna have him bring his arm out to the side like this with his elbow bent. I want his arm flat like this, because that's about neutral, right? And so you can do this 2 ways. I'll show you both. So you can do it like this. So for internal rotation, I would want him stabilized on a surface for this. So for internal, I'm going to stabilize here, or I would have a table or something, and he'd have his arm just off of it. And then I'm going to resist underneath like this and have him bring his palm down to the floor. Good. Just like that. And then same thing, stabilize down here and switch my hand for external rotation. Okay. And then you can also do it with their arm close to their body like this, having their arm be neutral just like this. You can actually do it just as a handshake, but make sure that you're stabilizing the upper arm to their body, because see how when he just did that, he brings his elbow up like that? I don't want that to happen. So I'm trying to stabilize it against his body and bring his arm in just like that, and then out. And you can switch your hand to be holding the back for that as well. All right, there you go. If you guys have any questions, please feel free to email me. Like I said, the entire lab packet should be filled out. It doesn't ask you to take goniometric measurements of anybody. Yes, it does. I lied. So don't worry about that part per se, but like all the normal ranges, all the prime movers, peripheral nerve innervations, and then also the special test sections should all be filled out. Please make sure to email those to me before April 6th. And please, please, please make sure to read the document that I will be posting along with this video. All right. Look forward to seeing your practicals. And again, if you have any questions, email me, please.